Okay, let's dive into this. Hello, everyone, and welcome to today's explainer. If you are a GP, a nurse, a carer, or part of a primary care team, you are right on the front lines of a really critical healthcare challenge. Today, we're taking a structured look at the NHS and NICE guidelines to equip you with the exact, practical tools you need to provide exceptional care for patients with learning disabilities. So, let's get right into it.
Look, we have to start with a pretty stark reality. On average, people with a learning disability die significantly younger than the general population. But what makes this a true crisis, what really breaks your heart, is that a huge proportion of these deaths are entirely preventable. We're talking about causes that absolutely could have been treated if they were just caught sooner. This isn't just some sad statistic. This is a literal life or death issue. The hidden health gap is very real, but the good news is that structured attentive care can absolutely solve it. So here is our roadmap for today. 1. The hidden health gap. 2. Unmasking diagnostic overshadowing. 3. The annual health check. 4. Adjustments, medication, and capacity. And 5. Red flags for urgent action. Basically, this explainer serves as your practical, step-by-step toolkit pulled directly from those NHS and NICE guidelines.
All right, Section 1, the hidden health gap. It's really vital to understand right out of the gate that providing good healthcare here isn't about running one single magical diagnostic test.
Instead, it's about building a robust, structured system of care. To close this gap, we're relying on 3 actionable pillars. Structured annual reviews to catch things early, accessible adjustments that make doctor visits actually feasible, and, this is huge, incredibly careful attention to symptoms that are honestly just way too easy to miss. Moving on to Section 2, unmasking diagnostic overshadowing. Now, what's really interesting about this concept is that it's kind of the hidden villain in our narrative. It's a psychological and clinical trap that even the most well-meaning medical professionals can fall right into if they aren't careful. So here is the crucial definition you need to remember. Diagnostic overshadowing happens when a new physical or mental health symptom gets wrongly blamed on the learning disability itself instead of being investigated as its own separate treatable problem. Mortality reviews show us that this cognitive trap is one of the massive contributors to those preventable deaths we talked about.
Let's put this into perspective with a stark comparison. Imagine a patient suddenly becomes aggressive. The easy but dangerous assumption is thinking, oh, well, it's just part of their learning disability. But the clinical reality, that sudden behavior change is very often a giant flashing warning sign for undiagnosed pain. We're talking about a rotting tooth, a severe urinary tract infection, or acute abdominal pain. We absolutely have to stop assuming that just because a patient struggles to communicate, it means they don't have acute treatable symptoms, because they do.
The golden rule, the crucial takeaway here, is this. Any new change in behavior, mood, or function should first prompt a search for a physical or mental health cause, not be assumed to be baseline. Empathy requires actual investigation. Please, don't just assume the baseline. Go look for the cause.
Okay, Section 3, the annual health check. This is where we shift gears from identifying the problem to actually implementing our primary tool for breakthrough and prevention.
And the magic number here is 14. Anyone aged 14 and over who is registered with their GP as having a learning disability is legally entitled to a free, structured annual health check on the NHS.
Now, I want to be super clear. This isn't your standard quick 5-minute routine checkup. It is highly comprehensive. It means checking weight, blood pressure, doing a full physical exam. It means reviewing medications, checking vision, hearing, and dental health. Crucially, it means evaluating mental health, behavior, and looking really closely at bowel, bladder, and swallowing health. The data tells us that higher uptake of these specific checks directly catches things earlier and literally saves lives.
Let's move to and see how this builds into a continuous cycle of care. Step 1 is completing that annual health check. Step 2 is translating those findings into a written, accessible health action plan, using plain language or pictures so you're outlining exactly who is responsible for follow-ups. And Step 3 is the annual review of that plan with the patient's family and cares, making sure everyone is on the exact same page.
All right, Section 4, adjustments, medication, and capacity. Here, we're looking at the critical frameworks that govern your everyday interactions, prescriptions, and the fundamental legal rights of your patients.
Let's talk about meds, specifically the NHS initiative known as STOP, Stopping Over-Medication of People with a Learning Disability. Historically, psychotropic medications and antipsychotics have been heavily prescribed simply to manage behavior and then left on autopilot indefinitely. We must actively question this status quo. During every single review, ask yourself, is there a clear, current diagnosis this medication is actually treating? Has it been reviewed in the last 12 months? Can we reduce or stop it with support? The default absolutely must be active review, not just indefinite continuation.
Next, let's demystify some of the legal jargon, because the law actually requires us to make care genuinely accessible. Under the Equality Act 2010, the core principle is reasonable adjustments. In practical terms, that means booking double or longer appointments, sending easy-read letters, and utilizing a GP record flag so the patient doesn't have to ask for the same accommodations every single time. Hand in hand with this is the Mental Capacity Act 2005, where the core principle is capacity assumed. Having a learning disability does not automatically equate to a lack of capacity. Consent is decision and time-specific, meaning you have to provide all practicable support to help the patient make their own decision before ever judging that they lack capacity for that specific treatment.
Okay, Section 5, Red Flags for Urgent Action. We are stepping into high-stakes, life-or-death territory right now. Because of the higher risk of missed illnesses, the following symptoms require immediate medical assessment. There is literally no room for a wait-and-see approach here.
Red flag number 1. A sudden change in behavior, alertness, or eating and drinking without an obvious cause. If a patient suddenly refuses meals or becomes highly agitated, you have to isolate that symptom. Treat it as possible pain, an acute infection, or a serious illness until proven otherwise by a medical professional.
Red flag number 2. You must constantly be on the lookout for signs of aspiration. If a patient with swallowing difficulties is coughing on their food or fluids, or if they're suffering from recurrent chest infections, that is urgent. Similarly, any new or worsening seizures, or even just a change in their standard seizure pattern, requires immediate escalation.
And this brilliantly illustrates the danger we talked about earlier, signs of constipation or bowel obstruction. Atypical presentations, like unexpected vomiting or distension, might easily be dismissed as behavioral. But severe constipation is a well-recognized, entirely preventable cause of death. You simply cannot ignore it.
And our final red flag, any signs suggesting abuse or neglect. If you see unexplained injuries, if the patient shows unusual fearfulness around a particular person, or if a carer is actively blocking you from seeing the patient alone, you have to act firmly. This requires an immediate safeguarding referral, no hesitations whatsoever.
So, to synthesize everything from today, good healthcare isn't a single check, it's a habit of looking past the learning disability for a treatable cause. Whether you're a GP, a nurse, or a carer, your vigilance and your commitment to working from a shared health action plan is what ultimately turns the tide.
Which leaves us with one final, pretty provocative question for you to reflect on. How will you change your approach to look past the disability during your very next appointment? Whether it's scheduling a double appointment, investigating a sudden mood change for physical pain, or questioning an outdated prescription, the power to close this health gap is right there in your hands. Thank you so much for joining me for this explainer, and honestly, thank you for the vital work you do every single day.